This episode of To The Point is sponsored by Tarsus. Tarsus Pharmaceuticals applies proven science and new technology to revolutionize treatment for patients, starting with eye care. Tarsus is advancing its pipeline to address several diseases with high unmet need across a range of therapeutic categories, including eye care, dermatology, and infectious disease prevention. Tarsus is proud to announce that XDEMVY Lotilaner Ophthalmic Solution 0.25% is now available to prescribe. Support for this podcast is provided by TearCare, a product of Sight Sciences. TearCare is a device that applies heat to the eyelids, where the current medical community recommends the application of a warm compress to the eyelids. Applications include meibomian gland dysfunction, MGD, dry eye, or blepharitis.
Ocular surface disease. It's complex, chronic, and progressive, but rife with opportunity for the enterprising optometrist.
The mission of this podcast is to make this condition more understandable and accessible to those interested in specializing in it. So let's get to the point. All right, welcome to our first episode of the To The Point podcast for 2021. My name is Jackie Garlick, and I am joined by my co-host, Leslie Odell. And Leslie and I are back to talk about all kinds of things. Hi, Leslie.
Hi, how's it going?
It's going good. It's going good. So last year we talked a lot about dry eye, how to build a dry eye practice. And 2021 is going to be about, well, we're going to surprise you. We're going to surprise ourselves, I think, on what we're going to talk about. But we do know what we're talking about today. And today we are going to talk about what is new in the dry eye space, what is coming up in the future, and just other things surrounding ocular disease. So I thought we could start by talking about what are some of the newer things that have come to market in the past year or two. Let's start talking about Oxervate. That is something newer to the space.
Yeah, that's a great place to start. So Oxervate, really, I think, has a lot of great opportunities for us to learn a little bit more about what that's treating, which is neurotrophic keratitis. And so it's really the first time we've had a medication that's been designed with that in mind. These patients have often been our most challenging dry eye patients, and it's exciting to have something like Oxervate to treat them. So I have some experience using that over the past several months. I will say that the heaviest lift is just really educating the patient on how to use it, because it comes in a very different, type of delivery system than we're used to and our patients are used to. But once you kind of work through that, and the company is very good about having online videos for that, I've actually had patients, in their 80s that were able to self-administer. So it's not a limiting factor, but it's good to know that it does look different as far as the delivery system than something we've been used to in the past.
Yeah, I would second that. I had watched their online videos on how to actually do that, because I think that is one of the hardest things when you're prescribing a new medication, something like this. If a patient asks you questions like, wait, how do I do this? If you don't know, then you feel uncomfortable, like you're not aware of how it goes. And so their website, oxervate.com, they have a great video on there on just how to do it, which would be educational for not only the doctor, but just for the patient too. Just because it's difficult to talk through it, you really do have to kind of see that video. This is one drop every 2 hours, so 6 times a day for 8 weeks. Have you had this experience where patients start to almost have a little more pain when they start using it as they start to regrow nerves?
I have, and that's what I was going to actually add to what you were saying. It is nice that we have that endpoint with 8 weeks, and the clinical trials are, and clinical experience show that it is really impressive at healing the cornea, and it does so by helping to heal the corneal nerves. So that is a conversation that you want to have with patients, is as they're going through their therapy, there is going to be a change probably in their perception of discomfort, and really kind of just working through that as best as you can. It does improve the longer they're using the therapy, but in their clinical trials, that was one of their most common adverse reactions was eye pain.
How has your experience been getting that medication to the patient as far as like, insurance coverage? Like, I know the company is very helpful in that regard, but can you talk about your experience with that?
Yeah, I feel like, Dompé's been doing a great job of trying to get this in the hands of our patients, and actually haven't seen if it's changed much this year, but they had a enrollment program so that you could make sure it was covered, because obviously this is not something that you're going to go to a local pharmacy for. The one thing that, when we're looking for the patients, I always think about, how are we have great options for medications now, but what's your patient selection? And so with this one in particular, I think it's really started to raise the awareness of neurotrophic keratitis, and you might see this 2 or 3 plus punctate keratitis, but just remembering to do things like check for corneal sensitivity, something that is relatively easy to be doing in our clinics. You don't need the Cochet-Binet testing. I use actually an unflavored dental floss for the way that I check corneal sensitivity in patients. I'm not sure what you do.
Yeah, I've done both the dental floss, or I've done dental floss, and I also would like do a Q-tip, like a swab, and just sort of pull out some of that cotton on the cotton swab and kind of roll it a little bit, and then do corneal sensitivity that way. I feel like for whatever reason I can never find my dental floss when I am going to do this, but I got swabs all over the place, so I end up going with that.
So I feel like right now I'm just a little bit limited with even how I open things, because I'm wearing gloves and I'm not accustomed to doing that. And so actually I have a lot more trouble. I'll have to get my wisp ready before I put my gloves on, because I do feel a little challenged physically right now.
Okay, so that's a super exciting thing. One thing that did, I think, come out in 2020, I think it was 2020, is Isuvis. And that is something that came out of Kala Pharmaceuticals, where it's designed to treat your flares, your dry eye patients that have these flares. Have you used this at all yet?
Yes, I've actually been using this quite a bit, and this has really been an exciting addition for me in particular, because I had been thinking about flares for a long time with patients. So I get excited when new medications are coming to be, because they just really help refocus education to us, the providers, and really restart conversations that maybe we should be having. So for me, one of the things I felt like I was doing a good job as a dry eye, specialist or, focus area for my patients was educating them when they would start on any therapy to let me know if they had a few days of worsening symptoms, and that I would be able to offer them something, right? And what that something was going to be a corticosteroid. Now that we have Isuvis and it's FDA approved for the short term, up to 2 weeks use for dry eye disease and dry eye flares, I'm really excited to now have something that I can prescribe on label. Also, their study, their clinical development program is one of the biggest around. So they had about 2,800 patients that were enrolled in that. And the safety profile of Isuvis was really overwhelmingly positive. Only 3 patients with an IOP rise above 21 or greater than 10 millimeters. And that was like 0.2% of that study population. So one of the things that, doctors get a little bit nervous about when they're maybe sending a patient home on a corticosteroid is, are they going to be causing an IOP spike? And I feel like, with the clinical data that we can look at, we should be able to prescribe with confidence.
Yeah. So Isuvis is loteprednol 0.25%. And this is, it feels like, oh gosh, how many different varieties of loteprednol percentage-wise can we actually have? But I think one of the things that really differentiates this, and they talk about this, is their Amplify technology. So this is their proprietary mucus penetrating particle drug delivery technology. And this is designed to enhance the bioavailability of loteprednol at the target site. this is this is unique to them, and that according to this, will have better efficacy with that. This is also the same company that came out with Inveltis, which is another percentage of loteprednol that's at 1%, and that was I think maybe 2019, or I think that's when Inveltis actually came out. But so this is great. We know our dry eye patients have these flare-ups, and I think to your point, it is a nice thing to remind them, like, if you have flare-ups, call me. Like, we have, I think it makes us think more about reminding our patients that they will experience these flare-ups, and that we do have like more on-label treatment for that.
Absolutely. And just really, to kind of continue on that conversation a little bit, is what we're living in, right? With a couple things right now, masks and this mask associated dry eye. So we might see an uptick in our dry eye patients, or flares of symptoms related to just, our patients that are working and wearing a mask for long periods of time during the day. The other thing would be the digital device use. So we see, on average, sometimes I see studies that show 13 hours of use of some kind of device. So these are patients that we want to be proactively talking about. We're in the winter now, but as the spring arrives and allergies start to flare, that's another area where allergy and dry eye kind of really combine to make our patients really unhappy. And so, we go from the dry winter air with low humidity to everything blooming and all the pollens that also creates that problem. So I think it's, again, a great opportunity. Some of these patients, some of the study from Kala is kind of surprising, or was kind of surprising to me, that I think they had 45% of patients were just experiencing flares. So if you think about that patient and you don't have it, in your intake form, or you're not talking to your staff about this as a possibility, you might completely miss a patient that is at risk for dry eye disease and having flares, because if it doesn't hurt that day, they might not remember, right? They might not remember how they felt 4 months prior to their eye exam. So I think the conversation with patients should really just be, do you have awareness of your eyes? This isn't normal. How many times, out of a year are you noticing that? And that would be really falling on all of our patients, right? And then we can become more proactive, which is always a great thing when we're talking about a chronic disease.
Something else that I've been hearing is not necessarily new, but I feel like I've been hearing a lot more about it, is the Regenerize drops. And I think the reason I'm hearing more about that is because now that's available through ABB. So, my ABB rep was like, "Oh, you treat dry eye. Do you know you can get Regenerize through us?" And I was like, "Oh, no." But I do feel like I've been hearing a lot more about that. I know you've used Regenerize, Leslie. This is like the drop has a lot of the same cytokines, growth factors, and nutrients that you'll find in amniotic membrane grafts, although it is in a drop. And they have two different varieties of this. They have a light and then a professional strength. And the light is, I think, a little bit maybe easier in that it's not refrigerated like the extra strength needs to be. It's more for your mild to moderate dry eye patients. And then the professional strength is more for your severe patients. And so this is something that you can actually carry in your office. You can carry bottles of this in your office and sell that to your patients. And it certainly, I don't know, it feels easier that I can get it through ABB because I get a bunch of other stuff through ABB.
Yeah. I'm glad to see that they're improving the access to, breaking down some of the barriers to get this. This one is appealing because there is no prior authorization that we need to go through. We can retail it right to the patient, and that's always a lot easier for patients. I actually was not familiar with the two strengths, and I think my experience has been mostly with the professional strength because, I do store it in the refrigerator and then send it home refrigerated. So that's exciting to actually I'll have to do a little digging into that mild.
They have the light, and actually I was just on the ABB website, and the only one available in this, I don't know if this is just for me, is the light. I didn't actually see the professional strength actually available, so I'm not sure if that's just something that's unique to me and I'm not able to get that one, but that's all I saw on ABB. But they do have two different variations, and the dosing for that is, it ranges depending on the severity, but anywhere from 1 to 4 drops a day is the typical dosing for that. And the other thing about the bottle is that it is good for up to 90 days. So I don't know, that's kind of a nicer thing. And I guess really how fast you'll fly through that depends on your dosing, obviously. But
yeah, and I think that's one that kind of gets tapered. You might start a patient out at, I think you would do maybe 4 times. You probably could even do a little bit more frequently to get them started, and then you would think about a tapered dose on that. But I think it's a good opportunity for a doctor that maybe doesn't have access to amniotic membranes, with either the cryopreserved or a dehydrated, get that started. And if your cornea is not responding, you might want to then pass along to somebody that has access to the membrane. I think it's also great for the patient that has been through a membrane therapy and needs continued treatment. Yep. So I think that's as far as, a cost perspective, I think too, you would see a big difference. There are some patients that we really want to do a membrane on, but we're challenged by insurance coverage or deductibles. And so that to me is another appealing place for this drop to fit.
All right, let's kind of switch gears from drops and talk about my meibomian gland treatment options. And there is a newer one that has come out from iEco where it's using vibration technology.
I think this is a really interesting and exciting area to kind of be thinking about when we're talking about meibomian gland dysfunction. And I know we touched on it a little bit before, but iEco has something called Tranquil Vibes. And that takes her traditional Tranquilize XL mask and kind of puts in this vibration ring that sits around the orbital bone and provides heat with vibration. And I've done some, research actually with her around that science within the past maybe 2 years. And it does help with in-office expression. It does really improve meibomian gland function, tear breakup times in patients. And so that's, definitely something I'm going to say we see growing. And I'm already starting to see that. There's a company called iDetect that has a warm compress that you may be familiar with. It's called iGene. It's a warm compress that doesn't require a microwave or anything. It's actually more of like a foil pack that you open up and the patient can use that without having to heat it. So it's kind of like a single-use type mask. But that company also is working on something called iLipid Mobilizer. And this is going to be interesting, I think. It's looking at heat and then something called mechanical resonant frequency vibration. And also what they're thinking is mechanical neuromodulation, which is a hot word right now, I would say. And that is coming together again in something that is called iLipid Mobilizer and should be, it's under development now. I know that they have a prototype in developed. So I think that's something that we're going to see here a lot more of over the next 12 months or so. Kind of just real quick, staying in line with that is in the heat mask space, we've saw Tear Restore, and I know that you have had some experience there, but that's, another, heat mask that is just kind of reinventing the way that we're doing that. Speaking of those digital device users, it might be good for our patients that don't want a closed eye experience when they're doing heat, and they can have that open eye treatment.
This episode of To The Point is sponsored by Tarsus. Tarsus Pharmaceuticals applies proven science and new technology to revolutionize treatment for patients, starting with eye care. Tarsus is advancing its pipeline to address several diseases with high unmet need across a range of therapeutic categories, including eye care, dermatology, and infectious disease prevention. Tarsus is proud to announce that Xdemvy Lotilaner Ophthalmic Solution 0.25% is now available to prescribe.
Did you do some research with this This is new to me, the vibration. What's the technical word? What did you call it?
Well, it depends. So with iEco's Tranquil Vibes, that she is calling just vibration. That is, I probably can't speak too much of, just because the studies are kind of we're in the process of writing them out as a paper, but it was, really, really good technology. The patient, again, could take it home. with what the eye lipid mobilizer is looking at, it's going to have a two-part in-office procedure, and then also the patient would take that home and continue therapy and home maintenance. And that, like I said, is in the development stage.
So is the vibration designed that like this vibration happens the entire time during the heat, and this gentle vibration somehow shakes these meibomian glands to sort of like loosen oil and help it flow out? Is that the right concept behind that?
With this new science, I'm not sure, exactly how that's going to look, if it's more of like a pulsating type thing, but I do know with the Vibes mask that I was talking about, that it was more of a constant frequency vibration that was happening. But I think that thought is kind of, around if you have thick butter and you're also shaking it while you're trying to liquefy it, it might move out quicker.
I mean, it makes sense. And yeah, it does make sense. So then is this thing plugged in, the Vibes mask? Is that plugged in?
It does have a USB connection. So yes. Mm-hmm.
Okay, what is coming up? All right, so the vibration thing with this new company is one of the things you mentioned, but also something that is coming up that's probably we're going to hear something in 2021 for this is Oyster Point. They have they submitted their NDA to the FDA back in December of 2020.
So December of 2020, that is really exciting.
Yeah, it is. So they have their OC-01, which is a preservative-free nasal spray. So this contains a nicotinic acetylcholine receptor agonist that stimulates the trigeminal parasympathetic pathway. And there was TruTear, okay, that was like Allergan's product that also worked by stimulating the trigeminal nerve. TruTear is now no longer; it's been discontinued. But I will say that the thought with this, I kind of always thought, and this is just my lack of understanding of this, but I'm going to say it in case anyone else also didn't understand. I kind of thought it was just going to be reflex tearing that was going to be happening with this. Like even TruTear, I kind of thought like, how is that really helping? Like you'll get more tears, but the balance is still kind of thrown off. Like I don't really understand that, but that's not really what's happening here. I mean, with the stimulation of the trigeminal nerve, that activates this, what's called the lacrimal functioning unit. And that includes the cornea, the conjunctiva, and the structures that secrete tear films, such as the lacrimal glands, the meibomian glands, and the goblet cells. So it's not just lacrimal gland function, which is what I incorrectly understood. I don't know. Was that just me? Did you think that? You probably knew the answer.
No, I think that it is exciting. And that was what was exciting even with neurostimulation with TruTear was the TruTear device. It wasn't just the lacrimal gland, it was showing to do the other things, like you said, the goblet cells and even the meibomian gland. So definitely had some challenges, at least with my own patient adoption. As soon as you kind of went to them with a two-prong thing that was going up their nose, it really was unappealing to patients. I think with Oyster Point, it's really exciting. And a lot of the science comes, from the same, the Dr. Michael Ackerman, who was behind TruTear. So it makes sense that, he kind of helped Oyster Point with this science. I think it's going to be really exciting again, because the conversation for dry eye is going to be like turned on its head. We're talking to you about dry eye and we want to give you a nasal spray. Like, are you insane? So I think it's going to be kind of fun. I think it's going to be fun to even, keep learning how Oyster Point is going to approach, eye care and show us how to have those conversations. I think patients and the adoption of patients with this science is going to be way easier because it's going to be familiar, right? Patients are familiar with nasal sprays. They're familiar with how they work. So I think that part's going to be easy. And I think it's really, again, the experience I had with TruTear when I found the patient that it worked, it was really exciting. So I think that this is going to just be so much easier and get to be in the hands of so many more patients. So I think it's going to be exciting to see how this goes over the next year. But I'm really excited to hear about the submission to the FDA.
Yeah, yeah. So I think this is also going to be great for the patient that maybe already takes a lot of eye drops. The glaucoma
Right.
patients, like
Yeah,
you don't want to
absolutely.
keep adding eye drops to them. This is a different delivery altogether that can still treat their dry eye. So that's
I
certainly
like
exciting.
that. I like that. And maybe even, I mean, if you think about that, I see a lot of my macular degeneration patients that are undergoing their injections that have a lot of surface problems, but they also have kind of, limited vision. So maybe if I'm nervous about giving them an eye drop that could be instilled incorrectly, a nasal spray delivery is going to be an easy way to improve adherence, and also maybe reduce some risk of self-induced trauma.
Yeah, totally. The other thing is, speaking of like trigeminal and neurostimulation, I forgot about this device, but iTear 100 came out last year too, and that is,
Yes.
that is like it does the same. It has this temporary, increase in tear production, but this one's different than True Tear, and that it's not a two prong in the nose. It's applied to the skin, like on the external sort of nasal, region, and that you apply for 30 seconds or less. This stimulates the trigeminal nerve, same pathway as what we've already discussed here. So, that I feel like I didn't hear that much about, maybe advertising wise, but that is something that came out last year also.
I have seen something around that, and now actually that I'm open and running, I probably have to figure out who to contact because again, that external vibration or stimulation, I think, is going to be much better received by the patient, and neurostimulation. Just like we've even seen with TFOS Du's 2 new definition of dry eye, this neurosensory part of dry eye is such a huge part. That's why we see things like Oxervate, this medication by Oyster Point, this technology that you're speaking of. So it's a part that we have a lot of learning to do, but it's a really exciting new frontier.
I also wonder, this is sort of anecdotal, but now that everyone has had to have COVID tests and maybe people are more comfortable with things being put up their nose, if True Tear just like missed its time and they would actually do that.
I often thought they should, if they just would have maybe had a one-sided prong versus at the same time, I think that also would have been.
I mean, I'm kind of joking because I don't think anyone enjoys the
thank
COVID
goodness,
test.
Though, I mean, thank goodness I'm not prescribing that right now because sometimes, the patient would sneeze all over me when they were doing it, and we would be doing it in the exam room. So it definitely would not be, perfect for the time we live in now.
All right, let's talk also about Tarsus. They have something in the works also as an eye drop for the treatment of Demodex. So that's very exciting. I was just talking to you before we started recording this about a Demodex patient that I have. So yeah, let's talk about Tarsus.
I, have been really excited about Tarsus since I first heard of them or saw some of their science back at SECO last year. So I did, get familiar with them just about a year ago. Demodex, we've talked a lot about in the past, and it's just been such a challenge to treat. It is the most common ectoparasite that lives on us, but it also, as we kind of reduce that visible sign with the collarettes, it comes back. And so having this therapy, an eye drop, again, that people are more comfortable with, doctors prescribing more, we're more comfortable prescribing an eye drop than we are a cleanser. And then also the patients, we just were talking about, they're comfortable with using an eye drop. When we're sending them home on some of these cleansers, I just haven't, some of them, are kind of irritating to the eye. So we encourage patients not to scrub. And so, and then we're seeing some conflicting studies or some studies that show that there could be some harm to meibomian glands with 4-terpenol in particular over time. So, having another option, I think, is just going to be a great thing, and it can't get here soon enough for me.
I know. Actually, I'm not sure when that approval is expected. Do you know that?
I think it's maybe. I think it might still be with a year away, but I'll have to check and see. I think about that. I think about a year away.
Yeah, they didn't submit anything, right, to the NDA. Like they didn't do an NDA yet. I don't think so either. No. Okay, yeah. All right, so a little bit on that.
But again, if you think about the education to doctors, they've done a great job just raising awareness already about Demodex. And so that has been really awesome to see. they've done a little bit of a pilot study, I think, with 1,000 patients that doctors from across the country would just evaluate them, just consecutive patients in the door. And they found a high number of patients with collarettes. What they're also really stressing is the importance of evaluating that superior lid while you're at your slit lamp and looking for the collarette, that clear waxy debris on the eyelash. And that's really all you need to make your diagnosis. So although it might be fun for some of us, I'm going to say myself, to do epilation and look for the Demodex under the microscope, Tarsus is really showing us that we don't need that. All we need is our slit lamp and looking at that superior lid to look for the collarettes.
Okay, and then let's finish up with something that is somewhat newer that I don't have a ton of information about, but I just want to bring it up in this call. There is a new dry eye treatment. It's called Reproxalab, and this is a new small molecule drug that's in phase 3 trials as a treatment for dry eye disease. This one I'm bringing it up because it's a different way to treat dry eye in its mechanism. So this is called a RASP inhibitor, which stands for reactive aldehyde species inhibitor. And it's a reactive molecule that binds to cellular biomolecules, disrupting their function and activating pro-inflammatory mediators. So this is just from their website here. I don't have a ton of information on it, but they're using this sort of RASP inhibition in various treatments, in allergic conjunctivitis, but also in certain systemic cancers. So, this is in phase 3, so we do have a little bit to go with it, but just something interesting and on the horizon I wanted to bring up.
Yeah, always exciting to hear new things like that, and definitely something to keep an eye on as the year progresses. And I'm sure, again, that's something that is going to be new to all of us, this RASP idea. And so, again, a big area for us to learn even more about dry eye disease. Just when you thought that we got through the first series and we had everything we needed to do dry eye the right way, now we're learning that there's all these things in the works that are going to teach us that we, have a lot more to learn.
Yeah. Learning is good. Okay, Leslie, I think this was a good first episode for 2021. Here's to many more.
And now for the To The Point wrap-up. The management and treatment of dry eye disease continues to evolve. 2020 brought us new medications with Isuvis from Kala Pharmaceuticals, as well as continued education around something now called dry eye flares. We continue to watch out for companies like Tarsus and Oyster Point Pharmaceuticals as we enter into 2021, as they both also have some really exciting technologies and management in the pipeline for chronic dry eye disease as well as Demodex. So these are companies we want to keep looking at. We also revisited some technology that's kind of getting used more widely with Regenerize, an amniotic membrane drop. Basically, what's really exciting is all the education that comes along with these new technologies. So I encourage you to keep learning and keep striving to do the very best for your dry eye patients.